Senator Kennedy, such a powerhouse on Capitol Hill, maybe irreplaceable. And we're going to take a look now at the bottom line on what's next, what it means for the Senate. We turn to Chief Washington Correspondent, as always, host of This Week, George Stephanopoulos. Good morning, George.
Hey, Kate.
Such an amazing tribute yesterday. But talk now, move us forward a little bit. What happens next with his Senate seat? Do we know who's going to replace even in the short term?
We don't know, first of all, if there's going to be a short-term replacement. As you know, Kate, Massachusetts will have to change the law to give the governor a temporary appointment until the special election, which is going to be early next year. It's a little complicated because in 2004, the Democrats changed the law to take the power away from the governor to make that kind of an interim appointment because they didn't want the Republican governor, Mitt Romney, to fill the seat if John Kerry became president. So they're facing some headwinds, charges of hypocrisy as they try to change the law, although there does seem to be more support for it in the last several days. And Vicki Kennedy, as you know, has been pushing very hard for it. For the interim seat, you're likely to find someone who's not going to want to have the long-term seat, maybe someone like former Governor Michael Dukakis. Whole bunch of people looking at the long-term seat, the special election in January, including perhaps former Congressman Joe Kennedy, the eldest son of Bobby Kennedy.
I have to say, 1 minute after the funeral was over yesterday, I got something in my inbox about health care from the DNC, the Democrats. How much do you think the death of Senator Kennedy will now impact the health care reform debate?
Well, there's an immediate impact in that the Democrats now have one less senator right now, harder to get to 60. They can't get there on their own. So that's number one. Number two, I think it might change the tone of the debate a little bit, might lower the temperature just a little bit, but I don't think it changes the fundamental dynamic of what's going on here. The president's plan, the Democrats' plans, facing some significant obstacles, doesn't rule out the possibility of a compromise down the road, but it's probably going to take a significant adjustment for the Democrats to get the kind of votes you're going to need to pass this bill right now, and that's going to lead to the whole debate over what would Teddy do. There's two different strands of his history. The liberal, roaring, partisan lion. A lot of people who want the public health insurance option say he would fight for it to the death. Others say, wait a second, there's a more pragmatic Ted Kennedy who would reach out to Republicans, get the deal he could. And I think that's going to be where the debate over Ted Kennedy's legacy goes next.
And does his not being there, does that make a huge difference, just in terms of the practical being able to work with both sides?
You know, it already has. I mean, I think that's what we've already seen. There's no Democrat in the Senate right now who combines the trust and credibility Ted Kennedy had with progressives, with liberals, and also the ability to reach out to Republicans. You've got Senator Max Baucus working with the Republicans, but liberals don't quite trust him. Ted Kennedy's best friend, Chris Dodd, loved by liberals, but doesn't have the kind of strong relationships on the Republican side. So that void has really been felt over the last year, and I don't think it's going to be filled.